Hello, my name is Edward Kim, and I'm a second-year fellow at the University of Pennsylvania, and I'm presenting our research, Same-Day Discharge After Minimally Invasive Sacrocopopexy and its Safety. I thank my co-authors, Chris Hong, a former Penn resident and now at the University of Michigan for fellowship, and Dr. Heidi Harvie, our faculty mentor at Penn. We have no disclosures. There has been an increasing interest in same-day discharge after minimally invasive GYN surgery. Our primary aim was to review the trend in same-day discharge rate after minimally invasive sacrocolpopexy, or MISCP. Our secondary aim was to assess its safety by comparing post-op complications between 1-to-1 propensity score match cohorts of same-day discharge cohort versus admitted cohort. We did this by using American College of Surgeons' NSQIP database from 2015 to 2019 to best reflect current practices. Patients were identified by using CPT codes, and we extracted data on concurrent hysterectomy and concurrent anterior-posterior repairs. We also extracted data on pre-op characteristics and post-op complications. Multivariate logistic regression and propensity score matching were used for our analysis. We found that there are 12,762 MISCP cases. About 31% were MISCP only. About 38% were with supracervical hysterectomy, about 31% with total hysterectomy, and about 29% with anterior or posterior repair. Same-day discharge rate across the board was about 16%, with an increase over the years during the study periods. And in terms of length of stay, the mean was 1.1 day, plus or minus 1.7 days. Median was 1 day. The range was 0 to 93 days, with 93 days being an outlier. And most patients were discharged on post-op day number 1 or 2. This is a graphical representation of same-day discharge rate stratified by whether or not patients had a concurrent hysterectomy. As I mentioned, the overall same-day discharge rate was about 16%, MISCP only 13%, with supracervical hysterectomy about 18%, and with total hysterectomy about 17%. When stratified by year, we see that in 2015, the same-day discharge rate was about 12%, and it increased to 23% in 2019. This is a table showing patient demographic and perioperative characteristics before and after propensity score matching. On the left, we have before propensity score matching. Among the admitted cohort, more patients were older, of Black race, had higher ASA class, lower preoperative hematocrit, diabetic, hypertensive, longer operative time, and had a concurrent anterior or posterior repair. Interestingly, more patients who had a concurrent hysterectomy were discharged the same day. Propensity score matching resolved all of these differences, with the exception of operative time, which was still significant, but the absolute difference was smaller than before matching. Propensity score matching produced 1,670 patients in each cohort. We saw that patients who were discharged the same day were twice more likely to develop superficial surgical site infection, and patients who were admitted were about 8 times more likely to receive blood transfusion. Other complications such as UTI, pneumonia, unplanned reintubation, other types of SSI, DVT-PE, return to the OR, and cardiovascular complications did not show statistically significant differences. In summary, same-day discharge rate is about 16% with an increase over the years. Superficial surgical site infection was more likely in the same-day discharge cohort, however the absolute rate was still low at 1.6%. Blood transfusion was more likely in the admitted cohort, however the absolute rate was still low at 0.6%. Most likely explanation for this is that patients who received intra- or post-op blood transfusion were admitted. Same-day discharge for carefully selected patients undergoing MISCP thus may be reasonably safe. Thank you.